Good morning. This morning I thought I would just talk a little bit about testosterone and the need for it for ladies going through their menopause and adding it in with their HRT. So there's a lot of information about progesterone and estrogen. Obviously we produce these, we know a lot about that. But there's less known about testosterone, and actually when we're in our 20s and 30s we produce 3 to 4 times more testosterone than we do estrogen. So again, it's a really important hormone that women need to replace when we're going through perimenopause and menopause. There's a lot of myths about testosterone. A lot of doctors are worried about prescribing it, thinking that we're going to grow beards and have a deep voice. This is very, very unlikely. It's only going to happen if you're hugely overdosing on testosterone. So when doctors come back with you saying something like that, they're really out of date and they need to update their knowledge on menopause. The unfortunate thing is, in this country, we only get prescribed the male testosterone, and I think sometimes this is where the issues arise with it, that doctors are a little bit concerned about prescribing it. But at low levels, it's perfectly safe to take, and to take for a long period of time. We need it. The only way you'll get it is if you say to your GP that you have low libido. God forbid that our partners do without any kind of conjugal rights. But as we know, ladies, it helps with lots of other things. It helps with brain fog, joint pains, just feeling energy, giving you energy, muscle mass, all these things it helps with. But the doctors won't be interested in any of that. So when you go and ask for the testosterone, you need to ask because you've got low libido. Most doctors will start you quite happily on your progesterone and your estrogen, and then they'll say to you, go away and see if after 3 or 6 months your sex drive comes back, and if it doesn't, then I'll look at prescribing you testosterone. I know there are issues around the country with GPs prescribing it. Sometimes it's not the GP's fault, their hands are tied. Different areas have different prescribing regulations. If it's not on their formulary, they cannot prescribe it. It's not that they're being difficult, although some of them are, but if they say it's not on their formulary, it is not on their formulary and they cannot prescribe it. You will then have to go to a private menopause specialist to get it. But it's quite easy to find out whether your area, whether it's on the formulary in the area that you live. You can just Google that. So if they're coming back to you and saying it's not on the formulary and you've Googled it and it is, then obviously, you can go back and sort of complain about it. So again, when you have your blood test done to see what your levels are, as with all hormones, you really need 2 tests at least 6 weeks apart. Our hormones fluctuate daily, they fluctuate hourly. So you could have a test now and you could have a test this evening and there'll be different results. So just having one test really is not enough, and it doesn't show a true reading of what's happening with your hormones. When you've had your test, if the doctor then comes back to you and says that your free androgen index is 1.5, for example, perfectly within range, yes, it is within range, but actually it's on the low side and you would probably benefit from having some testosterone. So anything really between 0.1 and up to 1.5, you really would benefit from having some testosterone. So do a little bit of research about it, go armed with the evidence and fight your corner for it. Anything above that, then generally your levels are fine and you may need to look at other areas to help with the issues that you're having, because the testosterone probably wouldn't help with that. Hopefully that's cleared up a few things for you about testosterone. I know there's a lot of stuff that I see on Facebook and everything about it. So, there's a lot of information out there, but you need to look at nice guidelines, look at the British Menopause Society and look at the Newson Clinic. They have all the researched evidence that you need, and that's what you need to take with you to your GP when you're fighting your corner. Okay, good luck, have a lovely day and enjoy this lovely weather. Bye.